I am my ancestors' wildest dreams. And I break the role by giving permission to my girls and young women around the world to really reach for their wildest dreams. My name is Emma Andrews, and I'm Vice President of Global Patient Advocacy at Pfizer. I am doing the unexpected by redefining what a woman in healthcare looks like. I was born in Kampala, Uganda, East Africa, but really grew up in Côte d'Ivoire. And I'm one of 7 siblings, so we're a family of 9. Similar to many other families, we fled Uganda during the Idi Amin era. And that's because my dad was a political prisoner for 11 months, and he was one of the lucky ones who survived. So we fled Uganda and resettled in Abidjan, Côte d'Ivoire. My mom, Veronica Namulondo, is one of my biggest influences. And it started down just really observing how she interacted with patients at the rural clinic where she volunteered. You could see that the healthcare system in Uganda was a lot more fractured after several years of civil war. Then we went to Abidjan, which was not as fractured, but you could still see the inequities when we came to rural versus urban settings. I just felt that it was unjust. Your zip code shouldn't dictate what kind of quality healthcare you get. And her influence was me wanting to do something about those inequities. And that led me to the path of becoming a pharmacist and getting my Doctor of Pharmacy degree. My team and I, we're responsible for leading the company's efforts of embedding the patient perspective across everything we do, from the earliest points in discovery to when a medicine is prescribed anywhere in the world. And then Aunt Pros taught me the importance of humility. She was the first female engineer, not only in Uganda, but in entire East Africa. I mean, someone would think that she would lead with that, but no. The important thing for her too is to pull others up. So she's made really a commitment to be a vocal about women in STEM. And then my second auntie is Auntie Liz. She had a 30-year career working with non-governmental agencies, and her career culminated as her being Deputy Director of the United Nations Development Program. So from her, I learned the importance of listening and the importance of inclusive leadership. And then finally, in my career at Pfizer, one that stands out is Dr. Frida Lewis Hall. She was the first Black female Executive Vice President, Chief Medical Officer.
Emma was responsible for establishing the Pfizer pharmacist engagement platform. This was perfect because she's so great at engaging and connecting.
And I remember reaching out to her and saying, I'd love to meet with you to just get your thoughts on my career aspirations. And she responded and made time.
So she came to me and asked for some career advice. And I asked her a question that I often ask, which is, what brings you joy? Because if you know what that is, then your passion shines through and you can't hold your authentic self back anymore. And it's been so exciting to see her grow and develop and deliver so much on behalf of patients.
The things that stick with me and I try and embody in my leadership is making sure that I make space, but also making sure I always think about what brings me joy. I absolutely love that I'm being of service to patients on a global scale.
I think Emma's superpower is connecting and including. She has the ability to connect to people, whoever they are, wherever they're from. I said included, and lots of leaders include people. But making people feel included, that's magic, and Emma has that.
I started my career in the community and hospital settings. There, I became acutely aware of how sometimes patients would walk in not really understanding what their diagnosis was, what their medicine was. And I realized the issue lies with the healthcare professional for us to be able to talk in a manner that patients can understand and that lead to activation. So that's where my passion for health literacy kind of was born. Health literacy simply means that you can share health information in a manner that can understand and that leads to activation.
Patients need a voice. And whether you're the translator for them, you're the amplifier for them, this is so critically important. Now, I've seen patient advocacy change, and I've seen Emma change it. And it's gone from asking for, demanding what we think you need as scientists, as healthcare professionals, to partnering with patients to help advocate for what they say they need.
The fact that our entire portfolio of innovative and off-patent medicines is going to be made available to 1.2 billion people in low and middle income countries at a not-for-profit cost gives me that energy to get up every day and do more. My husband and my daughters are my raison d'etre. You know, they really ground me, but also I'm an avid yogi and love the practice of it. Self-care, honestly, is something that's so important, but it didn't really come to light until I was in my 30s when I realized, you know what, I really needed an outlet. And I am so happy that I found yoga. It's such a central part of who I am and how I, re-energize and recalibrate. If young girls and women feel empowered, they will show up differently and be really true to themselves. And what does that mean? Giving them the tools they need, the mentoring, making sure that they build their network, making sure that they know that they stay true to themselves. Don't be afraid to be different, because your idea that you're afraid of might be the one that's actually going to change the world and change the way we're doing things. I'm honored to be a part of World Women Hour because of the women that shaped who I am today, and also because I'm very optimistic about the future leaders that are coming along, but also being very intentional that I'm also playing a role to be able to develop and bring those young leaders along.